Hello, everyone. Welcome to our webinar for Food Safety Education Month. It's already September, and I know many of you are already back to school and preparing for your work for the fall in educating consumers. Today's a great day for us. There's all kinds of stuff developing. We have launched our new website at FightBackorg. There are a few kinks, we acknowledge, but it's actually, I think you'll find it's easier to navigate. It's also mobile friendly. We have a bunch of new stuff we're going to talk about today, material, content you can use for Food Safety Education Month. So we will get started here. Welcome to all of you, and thank you for joining us today. We are recording this session. The session will be replayed, will be available on our YouTube channel. I also want to point out that we've included some handouts here, and included in the handouts are forms for the CEUs for CDR, for dietitians, and for the Environmental Health Association, NEHA, along with the logo for the new program that we're introducing, and permission for you all to promote that. So, without ado, let's get started. So today, I'm here to both be moderator, presenter, and to push all the little buttons to make things happen. So if there's a problem with how this gets conducted, it's entirely on me. I'm Shelley Feist. I'm Executive Director of the Partnership for Food Safety Education, and with me today is Jeannie Sneed. Hello, Jeannie.
Hi, Shelley.
Thank you so much for being with us. You know, it's always fantastic to have someone who's had so much direct experience working with consumers as well as studying their levels of awareness, and so I thank you for being with us.
You're welcome. I'm excited to be here. Thank you.
Good. Thank you. Again, the certificates from CDR and NEHA are attached to this webinar as handouts. That's something new I'm trying. I hope that works. Because it is National Food Safety Education Month, I think it would be great if folks who are on today's webinar thought about answering the question of what are you doing this month to promote consumer food safety education, and that I may share some of those when we get into the Q&A period. I think that there's amazing work going on at the community level among health agencies and cooperative extension and in schools. So don't be shy, and share that at any time. You can put that into the chat box and just say, hi, I'm in Nebraska, I'm doing this or that. Also, you can type questions in the chat box, and we will use those as fodder for our Q&A period, which will be the last 15 minutes of the webinar. So there'll be a post survey after the webinar, which of course I urge you to take because it helps us enormously in better meeting your needs. We like to hear from you about topics you're interested in, so please take a moment, if you would, to take that post survey because it helps us a lot. So today we're going to go over some consumer behavior data with Dr. Sneed. We're going to also preview for you the Go 40 or Below campaign. There'll be a number of resources that are beginning to launch over the next couple of weeks. And then we'll, of course, have Q&A. We'll also talk about the home food safety myths and facts for 2015, which are all around home refrigeration. So our theme really for the month is Go 40 and Below, home refrigeration, and how important that is to consumers reducing their risk of foodborne illness. We're going to talk about consumer research related to the temperature danger zone, the importance of home refrigeration, new downloads, content you can use, and then, again, sharing your ideas about promoting home food safety during September and beyond. So I would like to formally introduce Dr. Sneed, who's been a great friend to the partnership for many years. Dr. Jeannie Sneed is a food safety consultant. She was recently retired as a professor and department head for the Department of Hospitality Management and Dietetics at Kansas State University. She worked as a research professor in the Center of Excellence for Food Safety Research and Child Nutrition Programs that was funded by the U.S. Department of Agriculture. Thank you, Dr. Sneed, and I will do the slides for you.
Thank you very much, and I appreciate your inviting me to share information. As we all know, as food safety educators, temperature control and temperature management is so important to the safety of foods that people eat. When CDC has foodborne illness outbreaks that they examine, they always look at what are some of the causes or what are some of the risk factors associated with those foodborne illnesses. And if I can have the next slide, please. These are the top 5 that they have identified. And if you'll notice, the top 2 are both related to temperature control and making sure that food is at the appropriate temperature, both in terms of improper hot and cold temperatures, which really leads into the 40 or below campaign that Shelley talked about. But then there's also the issue of improper cooking temperatures, which we know becomes a real issue with consumers. So that temperature danger zone is really very important to us, and we know that that is that 40 to 140 degrees. And it also relates to the need to make sure that we store food properly, that we cook food properly, that we keep it in refrigeration or under heat for the appropriate amount of time. And that's going to reduce the risk that we have related to that. CDC also looks at what are the pathogens contributing to foodborne illness. And I know that one of the issues that the partnership has been looking at is Listeria monocytogenes, and how do we do a better job of controlling that. If we look at the top 5 pathogens, we all know that far and away norovirus accounts for the most foodborne illnesses, followed by Salmonella, Clostridium perfringens, Campylobacter, and then Staph aureus. So those are all major contributing factors to overall illness that we see related to foodborne illness. Shelley, is this where we have a polling question?
Yes, we're going to launch a poll. Thank you, Jeannie. So today we're curious to know, oops, that's what?
There we go.
We're curious to know from you what pathogen contributes to the greatest number of deaths in the United States. We'll take a minute for you to answer the poll, and then we'll share the results of what you think. So with about half of you having voted, we'll wait till a few more of you voted. We want to know what you think about which pathogen contributes to the most deaths. Okay, I'm going to close the poll, and we'll share the results here.
Okay, it looks like Listeria was the #1 cause, followed by non-typhoidal Salmonella, followed by norovirus, Campy, and then Clostridium. Let's see what the CDC data show us.
Yes, now I have to get back.
Go back one slide.
I know. How did that happen? Okay.
Okay.
There we go.
The CDC results, you were kind of close, but Listeria came in #3. Salmonella was the highest percentage, accounted for the highest percentages of death. But Listeria is pretty significant. And then we know with certain populations, like pregnant women, listeria is a very critical pathogen, and so it is really important that we take all of the measures that we can to control for the growth of listeria. So what I'm going to share with you today is some information about consumer food handling behavior related to temperature control. And these results are based on several different studies that we did at Kansas State University. The first was a national telephone survey conducted with 2,500 consumers nationwide, randomly selected, and they used the same questions that was used for the FDA Food Safety Survey so that we could do a little bit of tracking over time. All of these research projects or studies were conducted with funding from USDA Food Safety and Inspection Service. With the survey, they ended up doing landlines, and so we went back and did another 100 surveys with just cell phone users, which gave us a little bit of interesting information. We also did a study that was observational with 123 consumers. We had 3 different groups that we looked at. We had a control group. We had a group that got food safety messages related to the Food Safe Families campaign. And then we had the third group that just looked at the previous Ad Council messages. And then we had them prepare 2 recipes. One was an entree recipe with either raw ground beef or raw chicken and a fresh fruit salad. And so we were looking at how they handled those products. We videotaped them, and so that gave us some pretty interesting results, more related to cross-contamination than temperature control, but there were a few things related to temperature control. The other thing that we did is we did 4 focus groups with African American and Latino consumers and tried to explore more in-depth information about maybe some of the whys related to cook, clean, chill, and separate. So let's look a little bit about the results. The telephone study. 98% of the respondents reported that they know how to cook food safely. So I think that's one of the biggest barriers that we face from the get-go is people already perceive that they know how to do what they're supposed to do in terms of food preparation. And so one of our challenges as food safety educators is how do you make them understand that they may not be doing things correctly and those incorrect actions or practices could lead to a foodborne illness. So I guess once we get the answer to that question, I guess our jobs might be over. But anyway, that's the big question. 77% reported to wash their hands all the time before they begin food preparation. So, you know, that's a pretty good start, and that's a pretty big number. Whether or not that is indeed the case or not remains to be seen. Let's look just a little bit about some of the interesting findings when we compared landline versus cell phone users. The cell phone group certainly was younger. There were more males in the group. They had higher numbers of people in the household, and fewer people in the household were over 62. So it was a much younger population, which doesn't surprise us much at all. That group was much more likely to use personal devices in the kitchen, like tablets or cell phones, that sort of thing, which not related to temperature control, but related to just cross-contamination, might be something that we would want to keep in mind and think about as we talk about food safety with consumers. There were really fairly few differences between food handling practices between the 2 groups, but the cell phone group were more likely to take temperatures. And remember, of course, that's self-reported, but it did seem like they were more. And so maybe there is something with the younger groups. I'm not sure what it is. It may have to do with we're not teaching cooking at home anymore, so they're getting their cooking messages elsewhere. But I don't know. That's merely conjecture. In terms of food thermometer availability, if we look at the national survey and we look at it compared to the two earlier, the 2006 and the 2010 FDA surveys, we'll find that a few more people, a higher percentage, have food thermometers than did in earlier survey times. A few more had digital thermometers. The refrigerator thermometer availability was pretty stable over time, but more people reported that they had built-in refrigerator thermometers, which leads me to believe that there is some confusion between the dial and an actual thermometer. And that was borne out a little bit by some of our conversations with the focus group participants. So we need to help them understand that just because they're dialing it from a 3 to a 2 doesn't necessarily correspond to a specific temperature. So that's kind of an interesting finding. In terms of proper refrigeration temperatures and their knowledge of them, fewer thought that they should be higher than 41, and fewer thought that they should be lower than 32 degrees compared to when that question was asked in 2010. But still, there are 6% of the participants or the respondents, perhaps the population, that doesn't know the appropriate temperature. When we talk to the focus groups, most of them relied on sensory observations to make sure that their refrigerator was at the proper temperature. Most did not report ever looking at a thermometer or having a thermometer in their refrigerator. A couple of the comments that were made, one participant said, on a daily basis, I check the milk, which actually is, there's some credence to that if it's really cold. Another one says, if you get your lettuce out and it's frozen, you know it's too cold. So they're really relying on sensory observations as opposed to actually using thermometers. In terms of cooking food, and when do they check the temperatures of cooked food, you notice that a lot more people check it for roast than for hamburgers, which is of concern for food safety educators because hamburgers would be one of the riskier foods. Baked egg dishes, leftovers, most people didn't even think about the fact that they needed to check those temperatures. So pretty small. Checking for doneness, we asked how they did it, and taking temperatures, 17% did for chicken compared to only 8% for hamburger. Specific time seems to be one that a good percentage of the population uses, and then even more actually cut it open and look at the color. And we all know the fallacy of looking at color, particularly for beef items where the myoglobin changes color. So that's not a good indicator at all. And we know that there are issues like persistent pinking or premature browning, and so color is absolutely not an accurate measure of doneness of food. So something that we really need to work on. Okay, with our observational study, I told you a little bit about those groups already. 86 of the 123 used a thermometer. We purposely put the endpoint cooking temperature on the recipe. We wanted that to be a cue, and we wanted people to see that and do something with it. But still, only 86 of those participants actually used a thermometer. 106 of the 123 did cook it to the proper temperature, and then 64 of the 123 used the thermometer correctly. It was interesting that as we were videotaping, the researcher was in an adjacent room, but people would ask, how do you take the temperature? So people really don't know how to take temperatures properly, particularly for small items, like they were making a meatball recipe with the ground beef, and then they were making kind of a chicken nugget product with the chicken. So it was a smaller cut of meat, and so how do they take that temperature, I think, is confusing to consumers. We also did a survey of the 123 that observed group, and 42% reported that they cut hamburgers open to check for doneness, so they rely on color. 62% reported to use the time recommendations on recipes, so that becomes pretty important as well. 72%, so very much like the national sample, reported to have a food thermometer. Only 39% reported to have a refrigerator thermometer, and 83% reported that they never check refrigerator temperatures. So I think that's pretty common that people don't do that. If we look at some of the responses from the focus groups, again, most of them had thermometers, but they don't use them. They use sensory judgment, like the juices run clear, or they look at the pinkness, or they eyeball. So those are all responses given. Cooking time. So one person said, I know that the steak is 3 minutes on each side, so that's what they do. Or a lot of them relied on their self-perceived cooking acumen. It's just something I've been doing so long. So I've been doing it so long, I know how to do it. Another person said, I never use a thermometer. It's because I always learn to cook just looking at it, tasting it, and just kind of touching it. So those sensory methods are highly relied on to check for temperatures. And then if they cool food, most of them will refrigerate immediately, so about 25%, and then about 75% let the food cool to room temperature before they put it in the refrigerator. And if they cool it at room temperature, more use it, cool it for less than 2 hours. Related to thawing food, we asked the focus group participants what they did, and they talked about using the bottom shelf of the refrigerator. They talked about running water over it. Interestingly, a few of them did talk about thawing it as part of the cooking process, but there was frequent mention of thawing at room temperature. One participant says, I take mine out in the morning and then thaw it out during the day, then in the evening I cook it. Another one said, sometimes I put it on the counter, in the sink I mean, for 5 or 6 hours. And so they are leaving it out at room temperature for long periods of time. So conclusions that I would make in general is that as food safety educators, we still have a lot of work to do. I think we really need to explore what are some motivations for behavior change. What would we do to that person who says, well, I just know how to cook? How do we make them understand that by using a thermometer, they're increasing the likelihood that that food is going to be safe, perhaps for their young children? How do we effectively use methods of delivering those messages? And then for different age groups, there probably will be different effectiveness of messages and how you reach out to those consumers. If you do have any questions, please feel free to contact me. The results of the observation study, particularly related to cross-contamination, was published in January in the Journal of Food Protection. The other data has not been published, but if you need any more information, I would be happy to have you contact me, and I would be happy to address questions that you have. Thank you very much.
Thank you. Thank you, Dr. Sneed. I also want to remind you that we're going to take some questions, and obviously Dr. Sneed gave just a few data points from this pretty extensive study that was done through USDA. So please post any questions. Your questions wouldn't have to be limited to temperature control. That is sort of our focus for the day. But I'm sure you probably have questions about methodology or results. Thank you very much. We're going to move into sort of resource part of our webinar. The partnership places a high value on developing resources that are usable in a consumer education context by you, the backfighters. So that's what we're going to go into next. Before we do that, we're very curious, and the others might be curious, if you're working to promote consumer food safety through social media, and if so, what is the channel that you're using? So I'm going to launch our next poll on this question of, if you are doing consumer food safety education work, what are you using social media? And if so, which of these channels in social media are the ones you are using most? And other is an option for those of you who are using social media channels that aren't listed here. So let's take a moment to take the poll, and then we'll share it. So we have about 75% have voted. So if you haven't voted yet, I urge you to do so. Okay, I'm going to close the poll. Thank you all for sharing your sharing information with us about your use of social media. I'm going to close the poll and share it with everybody. So I think it's fair to say that really about half of people who are participating today, who do consumer education, are not using social media presently. If you have thoughts about this, please share that in the post survey. Maybe this is a topic you all would like more information exchange on. And 25% using Facebook, 5% Twitter, some on Pinterest, and some on other. So thank you very much. That's very interesting information for us and for your colleagues here. So we're going to move into talking about some resources that are available. I mentioned, and you should have received an email if you are on the Backfighter list, that the FightBackorg has been relaunched as a vastly overhauled site. We've combined all of our websites, our material from Holiday Food Safety, Team Food Safety, Be Food Safe, into one site. It is mobile friendly. And we will do everything we can to make sure that site is serving you. I want to thank the many backfighters who helped us with feedback and testing about improving the site. So that's big news for us as we kick off Food Safety Education Month. The other news for us, which I'm happy to share today with you, is around the development of the consumer home food safety myths and facts. Oh, it looks like I skipped a couple of things. The 2015 Mythbusters, new for National Food Safety Education Month 2015. There are 4 myths and facts, and the text, which we encourage you to lift and put into your newsletters, all of them focus on home refrigeration and reinforce the 40 or below campaign and the crux messages, and some of which address really very directly some of what Dr. Sneed heard from focus group participants, which is this reliance on sensory cues to tell people about temperature. So they're available for your use now. You can download PDF files today from FightBackorg under Food Safety Education, you'll see in the drop-down menu Home Food Safety Mythbusters, and then look for 2015, which will appear on the top. Those PDFs are available today for you to download and start to use. So myth number 1, and I'm just going to read through the myths and facts, and I think you will see that they are in line with some of what Dr. Sneed heard in her work. I know my refrigerator is cold enough. I can feel it when I open it. Anyway, I have a dial to adjust the temperature. And we say the fact is that unless you have thermometers built into your fingers, you need to use a thermometer to ensure your refrigerator is at or below 40 degrees Fahrenheit. And that dial, it's important, but it's not a thermometer. And then there's more text that describes that 43% of home refrigerators have been found to be at temperatures in this danger zone, and that it's important to have a refrigerator at or below 40 degrees. And that the dial is used to adjust the temperature, but it's not to measure the temperature. In our myth number 2, another myth that cross-contamination doesn't happen in the refrigerator because it's too cold in the refrigerator for bacteria to survive. But of course the fact is that bacteria can survive, and some can even grow, and Listeria monocytogenes is one we worry about in cool, moist environments like the refrigerator. We cite a study by NSF International where they swabbed kitchen surfaces and as well various parts of the refrigerator and what they found. And then a few, core things for consumers to remember about keeping fruits, vegetables separate from raw meats, poultry, seafood, eggs, to clean up spills immediately, to keep the refrigerator regularly cleaned with hot water or liquid soap. In our myth number 3, I left some food out all day, but if I put it in the refrigerator now, the bacteria will die. Again, the idea that the cold can actually kill bacteria, thereby rendering the food that's cold safe. So the fact is that refrigerator temperatures can slow the growth of bacteria, but they will not stop the growth of bacteria in food. And again, we talk a little here about the danger zone, the 2-hour rule, and how long to keep perishables in the refrigerator, that they don't last forever. They should be tossed or used within 3 to 4 days. Myth number 4, I don't need to clean my refrigerator produce bin because all I put in there is fruits and vegetables. Somewhat getting to the point that people don't view fresh fruits and vegetables as being the source of contamination. And naturally, we want people to eat fresh fruits and vegetables. We don't want to reinforce that, but we do want to tell people that the produce bin can be a source of contamination and that it needs to be cleaned, and that the NSF study did actually find the produce bin of the refrigerator to be the germiest area in the kitchen. So those are our 4 consumer home food safety myths and facts, Mythbusters for 2015. And again, to get into how they reinforce, so the myths and facts flyers are available in PDF. They're also available in JPEG, but the JPEGs, there was some issue with getting those into the new site, but they will be there within the next couple days. The myths and facts, can be worked into your September newsletters, your email outreach. We also have a fantastic and short new video PSA on 40 and below, or on home refrigeration. It features Dr. Robert Gravani of Cornell University, and how home refrigerator temperature is one of the most effective ways to reduce the risk of foodborne illness. I give you the YouTube address here to get the video. It's available now, and we urge you to use it in any public way, or however you want to share video content. It is on our YouTube channel, and our YouTube channel is Backfighter channel. 40 and below, introducing 40 and below. Very excited about this campaign, and we're very excited about all the effort that went into a thorough review of the fundamental messaging for consumers about home refrigeration. That was done by a science expert panel that gave us input, a communications expert review, where we really dug into audiences that really need to hear the messages that will help them in control of Listeria monocytogenes at home. And then input on some of our draft material, including the tagline. I want to thank, there may be a couple on the phone, but some of the backfighters who took part in a review of creative concepts and gave their input. The Go 40 or below focuses on that a home refrigerator at or below 40 degrees is one of the most effective ways to reduce risk of foodborne illness at home, and that you need to measure the temperature of your refrigerator using a thermometer. And then there are some supporting messages about keeping and storing food, thawing food, and cleanliness, avoiding cross-contamination. I want to also remind you of a couple of things as we move toward the end of the webinar. One, that we welcome your questions in the chat box. Please start to enter those. Two, we'd love you to tell us if you're going to be doing some consumer education for Food Safety Education Month, what are some of your plans? And then also that among the handouts that you hopefully are seeing in your control box here on the webinar includes the Go 40 or below logo in two versions, one with a tagline and one without a tagline. And those, again, you can use to promote this message. There's no permission required. We do, of course, though, always appreciate a mention of the partnership or of FightBackorg as a source for consumers to get more information. Again, the objectives really are to hone in on these two messages, and to Jeannie's point, clearly there's much work needs to be done to encourage consumers to be conscious that your refrigerator temperature, you can only know the temperature if you are actually measuring it. This initiative is a refresh of the Back Down home refrigeration campaign that was developed in 2004. So it's based on the same fundamental messages and the fundamental risk assessment that was done by the USDA and the FDA about the importance of home refrigerator temperature to reducing risk of listeriosis. So we talked a little bit about listeria, and of course it's interesting that perception of the group, and I think of many of us, is that it is very lethal. When Jeannie showed you the numbers, an important thing to have noted is that there are just many, many, many more cases of salmonella, and therefore there is a high death rate there. But there are many fewer cases of listeriosis, but a much higher risk of that's much more lethal and higher risk of death. Importantly, too, 9 out of 10 people infected are in one of these at-risk populations. Pregnant women, 10 times more likely to be infected. Hispanic pregnant women, 24 times more likely, and people over 65, 4 times more likely. So again, a critical message about refrigerator temperature, and hoping to move the dial in this behavior. Move the dial to reduce the temperature of your fridge and use a thermometer. The campaign messaging structure is, of course, the dominant messaging, again, being the use of the knowing the temperature and the use of the thermometer, and then these other messages. So as we build out various resources that you'll be able to access throughout the month, they will be around these topics. If you were on our webinar in July, we got into some detail about the communications plan around this campaign. This is before we knew it was going to be called 40 or below. So when we talked about the communications plan that would accompany this, and I encourage you to watch that webinar on our YouTube channel if you didn't have a chance to participate. We dug very deep into these various materials that are going to be available, the outreach plan, the target personas, their media habits, etc. So there's more detail on that. But these are some of the items. These are the items you can expect to see roll out. And then a lot of the communications plan, we're going to provide you with tools that help you present the campaign to your community, and also to contact local media outlets. That's probably one of the first things that you will receive is some really good pitch sheets that help you in approaching the media about why this is such an important issue for them to cover. So a key to success, as with all food safety messaging, a key to success is you, and making sure you have materials and things you need to get these messages out. So again, watch your email as these resources are released for 40 and below. They're bright, colorful. They will feature pictures of our target audience, and they'll be quite inclusive of both information about what listeria is, home refrigeration, and some fundamental facts about why it's a concern for these audiences. So if you're not on our email list, it's probably really, especially if you're not on social media, being on our email list is probably the only way you're going to learn about and receive the releases of these various things. So please make sure you have gone to FightBack.org and sign up if you're not already on our weekly e-blast list. Appreciate that. And as we get closer here to our Q&A, again, I want to remind you to type in your questions. If you have questions for Jeannie or for me, please put those in chat. I'm having trouble with my slides moving forward right now. Okay, so thank you. We will be putting the CU certificates at the events page, but right now they are attached as handouts, so that's probably the most convenient way for you to access them. Jeannie and me, we have our email addresses here. I'm looking forward to your questions. Please send them in so we can cover stuff. Let's see, I'm going to take a look here at some stuff that we've got. Any material done in Celsius. Our materials for the Partnership for Food Safety Education are all developed for a U.S. audience. We are not using Celsius in the campaign, but if there is someone interested in discussing a limited use agreement or about modifying the campaign for audiences that would need to be aware of Celsius, please contact me at my email address. Will we be able to get stats on how many people we send your way from our social media accounts? We send your way. Well, we will monitor. I know we can be informed of traffic that comes from websites that are directed to our website. I would not be aware of a tool that's going to allow us to do that, get stats on if they went to our website based on your social media post. But obviously you'd be able to look at how popular the post is or how many people shared the post. I hope that helps. I don't know how I make this bigger so I can actually read this. Have you ever thought of partnering with a company like ThermoWorks for others to try to get more thermometers in households? Oh, that's such a great question. Thank you so much for asking that. We have. We had a pretty significant, I call it a summit, a few years ago with thermometer companies. And we've not really just been able to get them enthused about going beyond selling thermometers to really partnering on a large-scale effort like that. I do think there's many retailers who are very interested in supporting their customers in this area, some of whom have done special promotions, and that's certainly something we'll be working with retailers on. Is the retailer may be able to compel the thermometer companies to partner with them. and that's something we would welcome. If anyone has had experience with that, that they want to share, let me know. Why do consumers follow the 2-hour rule in the TDZ and the food code? Okay, 2-hour rule in the TDZ and the FDA food code for food service is 4 hours. Yeah, we often get questions about that, a frustration about the difference between the food code and the consumer advice. I don't know, Jeannie, if you have anything to
I would rather go with a shorter time rather than a longer time. I always tell people, and I do more work with food service, and so 4 hours, but that's over the life of the product. And so you never know how the guy ahead of you has handled that food product. And so I think a shorter time is better than a longer time. I don't understand why there are different temperature danger zones for consumer versus retail. I don't know why that exists, but it does. But I would still feel more comfortable with a shorter time period.
Yeah. Okay. Thank you. And I think in some cases, I don't know, I wasn't here at the time this was said, but obviously for consumer, 40 might be easier to retain than 41. I'm sure there's somebody more expert on this on the phone than me.
Well, I don't think the 40 and the 41 really probably makes that much difference, because that 1 degree isn't that. And I kind of like the idea of using life begins at 40 as a kind of a reminder to people to be conscious of temperatures.
Yeah, that's a good social media tagline. I want to thank this backfighter for sending a note about what she plans to do. She says, for Food Safety Education Month, she's planning to have an informational table in the Community Health Center waiting room, breaking myths and raffling off a couple of thermometers for the refrigerator. I think that sounds like an excellent plan.
Great idea.
Attention getting, very good. All right, please keep your questions coming, or your not just your questions, but what do you plan to do for Food Safety Education Month? Because I'm always blown away by how much activity goes on, and also just the creative ideas people have. So this presentation should be available at our website. As I said, we're in a bit of it won't be right away because the new website is launched and we're fixing a few things. I won't be able to add this recording. But there is a video page at the new website, and you will find all kinds of stuff there, and it's very visual and easy to find. And we will get it there. It will probably be on the YouTube channel by tomorrow afternoon, Friday morning. What are different types of thermometers? Jeannie, I don't know. Is there anything in your research about the types of thermometers, or in the observational work, did they have access to thermometer to use for the refrigerator?
For the refrigerator. Right. No, with our observational study, we did not do anything with refrigerator thermometers. Okay. Those are a little trickier to find than food thermometers, in my opinion, or at least that's been my experience as I go to stores. And as refrigerators have changed over time, used to we had wire racks, and so you could get ones that would hang over the wire, and now they're any of the newer refrigerators have the solid glass racks. So if you're talking about refrigerator thermometers, I think just finding the one that's appropriate. With food thermometers, if they can go with digital and tip sensitive, that would be the easiest, as opposed to the old bimetallic stem that had the dimple. And people don't understand that from the dimple to the end is all temperature measuring area, and so that's a little bit harder to use than the tip sensitive.
Okay, thank you. We have a question. Are there resources for educators to use in cooking demos in farmers markets? that's a relatively general question. I mean, I would say if you're talking about, there's all kinds of literature at FightBack.org, including our Produce Pro campaign, which should appear there today. If not, please check back. That focuses on fresh fruits and vegetables. Again, if anybody's done outreach at a farmer's market, I don't know if you're talking about cooking, as in, you know, demoing a food thermometer. As Jeannie said, food thermometers are relatively easy to find at retail at different price points. Appliance thermometers or refrigerator thermometers are perhaps the more limited selection. But I would refer to, you know, a lot of the messaging that we have at Fight Back could be used in demos. And if you're interested in fresh fruits and vegetables, there's an entire campaign that's about that. Okay. Someone has made a comment about, have you ever noticed how cooking magazines seem so rarely to include reminders about washing hands and proper cooking or hot and cold temperatures, holding temps? I just can't understand that. Jeannie, any comment on that? I think that's right.
Well, that is true, and also, you know, we've talked about the Food Channel and how they could do a better job of reinforcing some of those, and unfortunately, chefs and some of the cooking stars are not particularly food safety conscious, so actually that might be a target market for us.
Yeah, I know that, yeah, Dr. Brune at UC Davis has a student working on this issue, and we're eager to work with them on what we might do to do some outreach in that area. But in the meantime, we'll work with making sure consumers know. Someone has provided a comment that for Consumer Food Safety or National Food Safety Education Month, they're featuring FightBack.org on their food safety website and an impact story about their educational efforts. And we love impact stories. We also have a blog, and we like to feature your stories of your program and your program impact. So please keep that in mind. I'm sorry if I'm not reading your names because this is a funny little box and it's awfully hard to read it. I think it's Tammy. Tamara is planning on posting information in the hallways of the YWCA for parents and teachers to see when they walk by. That's great. Where is a highly visible area in the building, you know, that serves parents particularly? Another backfighter is implementing a food safety for pregnant moms series of classes on Listeria, Toxo, Campi, and Salmonella. That's fantastic. So I hope you'll use the new 40 and below stuff. That's wonderful. This backfighter works for the expanded food and nutrition education program. We teach food safety and hand out refrigerator thermometers as a class incentive. Our classes are free to limited resource families, and we also hand out food thermometers and meat thermometers and teach participants how to use them. That's great.
And I would like to just make a comment related to that. I think that's fabulous. And one of the things that I noticed with the focus groups is some of them had participated in extension activities, and they knew the material. They knew the information. And so you are making a difference. So keep going. Keep at it.
Yeah. I like this comment, too, because I agree now. And this was just on the slide, but there was an image of a person with a cane used when depicting those of us who are 65 plus. Why not depict an active person? I assure you, none of the photos will show people with a cane. It was on that slide. That's much more positive, don't you think? I agree. I think it's, you know, this is a whole area, Jeannie, that I think is really interesting, is about the change in one's, you know, immunity that can occur at you know, over a certain age, but you know, people are quite young and active and feel that way, so
Right.
it's tricky
Right.
to, you know, you don't want to tell them this is somehow you're falling apart, but there can be a change in your.
Well, and while they're starting to get wake-up calls, there still is a little bit of that sense of invincibility that goes on until something really kind of life-threatening happens. But you're right. I think the older people are just getting more active and, you know, helpful all the time. So, which is exciting as I approach that.
Yes. I think that's you know, particularly important. Yeah, is how do you talk about that change, and but it's not scare people, but also have them be more aware, because foodborne illness is the kind of thing that you can be a relatively healthy person and it can really take you out, and that's something we need people to be aware of without appearing to scare them. Will there be any special incentives, presentations, or resources to teach expectant moms and parents about food safety? There are some great resources now. I'll name a few of them. The Food and Drug Administration has something called Moms to Be. It's a very good, comprehensive set of materials for expectant moms. I'll name a couple things, and then Jeannie might know some. We have at FightBackorg a fantastic item we call the crib sheet for parents and caretakers of young children. And this was derived from a very extensive set of materials that were developed by Clemson University for the daycare provider setting. And what we did is we thought, well, wow, so much good work went into thinking through all these risks in the daycare setting. How might this apply to, you know, someone who takes care of children at home? So crib sheet is an 8-pager that really gets into things like bottles and care of bottles, formula, diapering surfaces, and why it's particularly important to make sure they're clean and sanitized, and that kind of stuff. Is there anything you'd add, Jeannie, from your experience about resources for expectant moms, parents?
I'm sorry, nothing comes to mind.
Okay.
But I'm sure within Extension, there must be several states that have some good materials.
Yeah. Moms to Be is very good. And then, of course, we'll be talking about this 40 and below. And then there's all kinds of stuff for kids. Obviously, kids represent half of the hospitalizations for foodborne illness. So that's an important thing for parents to be aware of. All right, there's all kinds of good questions. Will we get a certificate? Look at your handouts. If you could see the handouts in this column on your right, your control column. I think the NEH one may have to be upgraded. Hopefully they'll take it because they are accepted that we'll be doing it. But what's attached here as handouts should work for you. Okay. Will you have materials that appeal to a middle school age audience, not for 40 and below? Now, for Mythbusters in the past, we've done some kids material. This year, we were a little bit understaffed on being able to prepare those. We will see about getting a PowerPoint up there. And can we get a set of slides when this is over? They are terrific, yes. Again, it won't be right away. We're in a transition on the website, but look for that. And what we'll normally do is we'll send an email and say, if you missed the webinar, you know, here's where you can get the slides. So with that, we're at 2 o'clock, and I just want to send out a shout out to all of you who do this work, and thank you so much for what you're doing, for the incredible sharing you do when we come together. The Partnership for Food Safety Education will continue to do these webinars. We'll continue to have a fantastic website for you. Our emails always will send you to a resource. And we're beginning planning in the near future for the next Consumer Food Safety Education Conference. It won't be in 2016, but it's going to be soon thereafter. Thank you again for participating, and I want to thank these sponsoring partners of the partnership to help make things like the webinar possible. Thank you, Dr. Sneed, for being with us from Oklahoma, and I want everyone to have a fantastic Labor Day weekend.
Thank you, Shelley.
Thank you all.